Okay, done. Welcome back, guys. Now in this class we'll be starting with the vascular pathology, right? So we are going to discuss about the problems which are going to occur for the vessels, the vascular pathology, sir. Okay, so first we will do the vascular pathology, later we can go over the cardiac. Okay, it's like cardiovascular pathology, right? So first we will do the vascular pathology. What are the problems that can occur with the vessels? Okay, the main important topics, that's the vasculitis. After that, we are also going to discuss about atherosclerosis. Okay, sclerosis, the hardening of the blood vessels. And also, we'll be saying some important tumors that are going to arise for the blood vessels, the tumors of the blood vessels. Okay. Now, in this class, let's begin with the vascular pathology. Okay, vascular pathology. Now, here you can very clearly see, this is a normal, sir. Okay, the normal histology. On the left side, I am showing you, say, this is how an artery is going to look like. So, this is the lumen of the artery. The arteries are going to have a thick wall. The wall of the arteries are going to be thick. Okay, and here see in the veins are having thin walls. Veins are thin walled, arteries are thick walled. But the point which I want you to know is, see, so your blood vessels are having how many layers? Your blood vessels are made up of 3 layers. 3 layers are there. What are they? The innermost layer, this layer is called as the tunica intima. Okay, this is the tunica intima, sir, intimal layer. Okay, so the tunica intima, which is lined by the endothelial cells, the endothelial layer, tunica intima. Now, after that, so this muscle layer, which I am highlighting here, the muscle layer is called as the tunica media. Tunica media is made up of the smooth muscles. And the last layer is this layer, this is the tunica adventitia. Okay, that is the adventitial layer. So, now tell me, how many layers are there in the blood vessel? In the blood vessel, there are 3 layers: tunica intima, tunica media, and tunica adventitia. Same with the veins also. Now, apart from that, what else you should know? Look here, this is a tunica intima, tunica media, and here is tunica adventitia. Okay, 3 layers are there. But guys, have you appreciated that? So, there is this blue color wavy lining is there here. Okay, so this blue color wavy lining which is present between the tunica intima and tunica media. So what is this? So this is called as internal elastic lamina. Okay, elastic fibers. So this is called as the internal elastic lamina. Even here you can see very clearly. I hope you can see here. So this is the internal elastic lamina. Dekho, internal elastic lamina. And between tunica media and tunica adventitia, there is one more layer present. This blue color layer. Okay, so this wavy layer which I am highlighting right here, this is called as the elastic lamina only, but that is external elastic lamina. Internal elastic lamina, see, this is the internal elastic lamina, this one, and here this is the external elastic lamina. Okay, now in your exam they can ask you, so these elastic fibers are stained with the staining. So what is the stain that is used to look at these elastic fibers? MCQ. Here you can very clearly see, so the histology which I am showing you, this is actually a vascular pathology. Later we will discuss. It's a type of vasculitis. But here, are you able to appreciate this wavy fibers, the internal elastic lamina, sir? So remember, Verhoef Van Giesen stain. Okay, MCQ. The Verhoef Van Giesen stain. Okay, it is commonly used. Say it is commonly used to visualize the elastic tissues. Okay. So the elastic tissues are stained by, the elastin fibers are stained by Verhoef Van Giesen stain. Okay, that's the MCQ. Now after this, let's begin with the vascular pathology. Say something normal I have explained you. Blood vessels, normal histology I have explained you. So the first vascular pathology that I am going to discuss is vasculitis. What exactly is vasculitis? Vessel, right? Vasculitis. In the vasculitis, what is that vas? Vas means vessels. Itis means inflammation of the blood vessels. Okay, so vasculitis, it is an inflammation of blood vessel. Okay, it's the inflammation of the blood vessels. Why inflammation of the blood vessels, sir? See, the pathogenesis, the pathophysiology is very poorly understood. There are different types of vasculitis. There are different reasons, but in general, the pathophysiology of the vasculitis is poorly understood. Idiopathic, sir. We don't know why exactly the vessels are getting inflamed. In different conditions, there might be different reasons, but in general, I am telling you, the pathophysiology is idiopathic, sir. Okay. Now, how many types of vasculitis are there? So wherever you go worldwide, the same 3 things. Vasculitis is divided into, okay, 3 major types. 3 types of vasculitis. So one is large vessel vasculitis, medium vessel vasculitis and small vessel vasculitis. For example, if you are having vasculitis to larger blood vessels, okay, big sized blood vessels, then it is called as a large vessel vasculitis. Okay, large vessel vasculitis means the blood vessels which are involved in the process of inflammation are larger in nature. So large blood vessel getting vasculitis is a large vessel vasculitis. Simple, right? So medium vessels, if they get vasculitis, that's called as a medium vessel vasculitis, and small blood vessels, if they get vasculitis, that's called as a small vessel vasculitis. Now examples are very important, sir. What are the examples of large vessel vasculitis? Large vessel vasculitis includes temporal arteritis. Okay, not arthritis, arteritis. Arteritis means inflammation of the arteries. So temporal arteritis, also called as a giant cell arteritis. Okay, temporal arteritis, the temporal artery getting inflamed, temporal arteritis or giant cell arteritis. And Takayasu. So temporal arteritis and Takayasu, T for T, see, TT, both are TTs. Okay, temporal and Takayasu. Both these are large vessel granulomatous vasculitis. I will discuss. Now medium vessel vasculitis. Medium vessel vasculitis includes polyarteritis nodosa, PAN. Okay, we have discussed about the polyarteritis nodosa in the topic of in the topic of necrosis also. Polyarteritis nodosa. Okay, PAN. What type of necrosis will occur? Fibrinoid necrosis. We have discussed in the cell injury. Okay, necrosis topic. Now Kawasaki disease. Okay, Kawasaki disease, which is going to occur for the children, especially before the 4 years of age. Okay, which is usually seen in small children. So we'll discuss polyarteritis nodosa, Takayasu arteritis or Takayasu disease, and thromboangiitis obliterans. Okay, thromboangiitis obliterans, also called as the Burgess disease. This is the exact question asked in 2019 June FMG exam. Okay, so thromboangiitis obliterans is also called as, is the other name for Burgess disease. Simple MCQ, Burgess disease. Okay, see, thromboangiitis, in the name itself is there. Angiitis, inflammation of the blood vessel. Thrombo means occlusion. The blood vessels are getting occluded and even thrombus is going to form. Okay, because of the thrombus, the blood vessels are getting occluded. Okay, thromboangiitis obliterans, obliterated. Okay, now small vessel vasculitis. What are the examples of the small vessel vasculitis? The small vessel vasculitis includes Wegener's granulomatosis, microscopic polyangiitis, and Church-Strauss disease. Okay, Church-Strauss disease. What are three small vessel vasculitis? Wegener's granulomatosis, Wegener's. But remember it like Wegener's. Why? Later you will understand. Wegener's. Okay, but generally Wegener's granulomatosis, microscopic polyangiitis, and Church-Strauss disease, as well as one more thing, Hematuria purpura. Okay, Hematuria purpura. It is also coming under small vessel vasculitis, sir. So now just tell me, how many types of vasculitis are there? Sir, vasculitis, first of all, it is inflammation of the blood vessels. There are three types of vasculitis: large vessel vasculitis, medium vessel vasculitis, and small vessel vasculitis. Large vessel vasculitis examples: temporal arteritis and Takayasu arteritis. Medium vessel vasculitis includes polyarteritis nodosa, Kawasaki disease, and thromboangiitis obliterans, which is also called as the Burgess disease. And small vessel vasculitis includes Wegener's granulomatosis, Church-Strauss disease, microscopic polyangiitis, and Hematuria purpura. Done. Enough. So you know the classification also. Now after this classification, now you need to understand, sir, this vasculitis, in this condition, it is associated, usually this vasculitis is a condition associated with ANCA. Okay, in vasculitis, you are going to have this ANCA, sir. In which vasculitis, I will tell you. First of all, what is this ANCA? ANCA means anti-neutrophilic cytoplasmic antibodies. Now, whoever have this vasculitis in their blood, you will find this antibody called as ANCA, anti-neutrophilic cytoplasmic antibody. How many types of ANCA are there? There are actually three types of ANCA, but for your exam purpose, mainly two types of ANCA, sir. Two types of ANCA. What are they? P ANCA, C ANCA. There are two types of ANCA, P ANCA, C ANCA, sir. Now, what exactly is this P ANCA stands for? P for perinuclear ANCA. Means antibodies are produced. Okay, antibodies are produced against what? Against the neutrophil. See, name, anti-neutrophilic. Where the antibodies are going? Antibodies are going and attacking the cytoplasm. Anti-neutrophilic cytoplasmic antibody, but okay. But then what is this P ANCA, sir? What is P ANCA? See, now look, around the nucleus. What you are seeing here is around the nucleus. You are having this fluorescence. Means antibodies are going and getting deposited around the nucleus, sir. So perinuclear Perinuclear. P stands for perinuclear ANCA. Okay. And what is C ANCA? Okay, what is C ANCA? Before telling you C ANCA, see, in P ANCA, dekho, P ANCA, sir, antibodies are getting produced, okay. Antibodies are getting produced, but against what? Why antibodies are getting produced? We don't have a proper reason. But antibodies are produced against a component called as myeloperoxidase. Against this myeloperoxidase, the P ANCA antibodies are produced. So P ANCA is produced against myeloperoxidase. The antibodies are going and getting deposited around the nucleus. Done. Next, C ANCA. What the hell is this C stands for? C stands for, it's a cytoplasmic. Okay, so it's a cytoplasmic ANCA. See, entire cytoplasm. Okay, not just the perinuclear region, not just the perinuclear region. The entire cytoplasm is giving fluorescence because the entire antibodies are deposited in the entire cytoplasm. All the antibodies are deposited in the entire cytoplasm. So it is cytoplasmic ANCA. The other is perinuclear ANCA. There are two types: perinuclear ANCA and cytoplasmic ANCA. P ANCA is produced against the myeloperoxidase. Okay. Then C ANCA is produced against. It is produced against proteinase 3, an enzyme called as proteinase 3. It's produced against an enzyme called as proteinase 3, sir. Done. Now, the questions which will come in your exam. From here, these are the exam questions, sir. The exam questions, sir. So, okay, P ANCA, C ANCA, two types of ANCA are there. Okay, understood. Where these are seen? Where these are seen? See, this P ANCA is seen in many conditions, sir. It's seen in many conditions, like especially in the small vessel vasculitis, microscopic polyangiitis, Churg-Strauss syndrome. Okay, we have discussed the microscopic polyangiitis, Churg-Strauss syndrome. In the small vessel vasculitis, there is presence of P ANCA. And where you will see C ANCA. Okay, the C ANCA, it is seen in Wegener's. That's why I said you. Wegener's, W-E-C, C, not Wegener's. Why I ask you to remember? As Wegener's, because of presence of C ANCA. In Wegener's granulomatosis, now you will get it out. Sir, what exactly is this Wegener's granulomatosis? Where we have studied about this? Wegener's granulomatosis. Dekho here guys, Wegener's granulomatosis is also a type of small vessel vasculitis, right? So in Wegener's granulomatosis, 75% of the cases, in 75% of the cases, there is presence of C ANCA, and in 25% of the cases, still P ANCA is positive. So P ANCA is present in Wegener's granulomatosis, true. It is present in microscopic polyangiitis, Churg-Strauss syndrome, true sir. But in 75% cases of the Wegener's granulomatosis, there is present of C ANCA. Okay, P ANCA is present in many other conditions, even in inflammatory bowel diseases. Okay, inflammatory bowel diseases, ulcerative colitis also, there is presence of this P ANCA. Okay, now done. So what we have seen so far, we have seen normal histology completed. One important stain. What is the important stain? Verhoeff Van Janssen stain. Okay, Verhoeff Van Janssen stain is used to stain the elastic tissues, and the classification of the vasculitis, small vessel vasculitis, medium vessel vasculitis and large vessel vasculitis classification is completed. After that, I have explained you about the ANCA. ANCA are nothing but the antibodies. There are two types of ANCA, P ANCA and C ANCA. P ANCA is seen in Churg-Strauss disease as well as microscopic polyangiitis. Wegener's granulomatosis, it shows both P ANCA as well as C ANCA. Mainly C ANCA, 75% of the cases. Now after this, now look here and tell me. Sir, just simply I am giving an image based question. Now, there is this old woman, okay, 60 years old woman. Now, she is having severe headache. Now, if you look at her temple region, then this temple region, are you able to appreciate this inflamed arteries, this inflamed blood vessels, sir? Okay, I hope you can appreciate that. So, what exactly is this type of vasculitis? Any idea, guys? Guys, do you have any idea? I am talking about which type of vasculitis? Any idea, guys? Hello, Varun Kashyap. Yes, Varun Kashyap, you are asking about the streaming, right? See, from our side, again and again, I am telling you, we are running with a high speed Wi-Fi network. So there is no issue from our side. Like, guys, other users, guys, do you have any issue with the buffering? Like, any issue with the streaming? Like Varun Kashyap is asking, that streaming is little buffering. I think it's problem with his internet. Is everything okay with other guys? Yeah, so it's okay with others. So okay, anyway, so now this is a giant cell arteritis. So now this image itself is telling you. So giant cell arteritis, just tell me, so giant cell arteritis is going to be seen in females or males? It's going to be seen in females or males? Mainly females. Older females or younger females? Older females. Okay, so let's write the important points one by one, sir. One by one, let's write the important points. Okay, so this giant cell arteritis, right? AKA, also known as temporal arteritis. Okay, it's also called as temporal arteritis. Seen in which sex? Mainly seen in females. In your question also, the question will come, the female of age how much? More than 50 years, sir. Not an younger female, but an elder female. So what is the most common complaint? What is the most common clinical feature? So the most common complaint, okay, the most common complaint and the most common presentation is unilateral headache. Okay, she's going to have severe unilateral headache, temporal pain. She's going to have a headache, sir. Why? Why she is having headache? Because the most common blood vessel, okay, the most common vessel involved. You know what is the most common blood vessel that is involved in this type of vasculitis? This is in the name itself. It is a temporal arteritis. So it's a superficial temporal artery. Okay, superficial temporal artery. Okay, the superficial temporal artery that is getting inflamed, sir, that is a temporal arteritis. Okay, temporal arteritis. See, most commonly it is seen in females. It doesn't mean it's going to occur only in females. So most commonly it is going to occur in females, but yeah, males also will get this. Okay, males also will get this. Okay. Next, so the most common blood vessel that is involved is the superficial temporal artery. Then apart from superficial temporal artery, even facial artery. Facial artery can be involved, sir. Facial artery. Now, what is the most specific presentation? Most common presentation is unilateral headache. Then what is the most specific presentation? Any idea? Most specific, you know, the facial artery is going to take a turn like this. At the angle of the mandible, the facial artery is going to take a turn like this. Okay, it's a tortuous blood vessel, the facial artery. If the facial artery is involved, if the facial artery is inflamed, whenever you open your jaw, that's going to cause pain. So that's going to cause a pain. So that's called as a jaw claudication. Okay, these are all MCQs. So jaw claudication is the most specific presentation, guys. Most specific presentation which you should never ever forget about it. Okay. So any other things, any other problems that are seen in this temporal arteritis? See, usually these patients will also have the problem with the joints. Okay. So joint pains. The joints are going to be painful. Multiple joints are going to be involved. So this condition is called as polymyalgia. Okay, joints and even the muscle pains will be there. Okay, polymyalgia rheumatica. Okay, so polymyalgia rheumatica, joint pain will be there, arthritis will be there, muscle cramps is going to be there. So this polymyalgia rheumatica is associated with which type of arthritis? It is associated with giant cell arteritis or temporal arteritis. Okay. Next, the main problem with this patients is, so this inflammation might involve, okay, this inflammation can even spread to the optic nerve. Okay, so that can lead to visual loss. So that's the most the problematic thing. Let me write here. Severe complication. The complication is going to be vision loss. Okay, so vision loss, the inflammation can spread to the optic nerve, ophthalmic artery, so that can lead to vision loss. Okay, sudden vision loss can occur. So that's why it's the most severe complication. So whenever a patient comes to you and you diagnose that this patient is having temporal arteritis, and if she is having blurring of the vision, okay, if she is having any visual abnormalities, then immediately start steroids. Okay, so immediately start the steroids. Why steroids? Okay, why we have to give the steroids? Because steroids are the they are going to they are going to be anti-inflammatory. They are going to stop the inflammation. Okay, they are going to stop the inflammation. Also start aspirin. Okay, so the blood vessels are not going to in the blood vessels clot is not going to occur because of the inflammation. The clot formation will not occur, sir. It's an antiplatelet aggregate, right? Aspirin is an antiplatelet aggregate. So thrombus formation will be stopped. So these are the severe complication, that is the vision loss. So whenever a patient comes to you with a visual abnormality, start immediately start with the steroids and aspirin. Okay. So now tell me important points about the giant cell arteritis. The giant cell arteritis first. Is it small vessel vasculitis or large vessel vasculitis? It's a large vessel vasculitis, sir. So it's seen in males or females? Mainly seen in females of elderly age group, more than 50 years. Okay, what is the most common blood vessel involved? The most common blood vessel that is involved is superficial temporal artery. Superficial temporal artery. Okay, apart from superficial temporal artery, multiple arteries can be involved. Even facial artery can be involved. So this involvement of the facial artery can lead to jaw claudication. Whenever the person will try to open the mouth or do any movement, that will cause the pain. Jaw claudication is going to be seen. Okay, what is the most severe complication? Vision loss. Okay, blindness is the most severe complication. And joint pains will be seen, joint pain, arthritis will be seen. That is called as a polymyalgia rheumatica. Okay, so now what I am trying to put into your mind, your mind here. See, this is the blood vessel. Okay, this is the blood vessel which is involved in the vasculitis. Okay, this is the blood vessel which is involved in the vasculitis. So because of the inflammation, the lumen of the blood vessel is getting narrowed. The lumen of the blood vessel is getting narrowed. So the perfusion to the tissues will be greatly compromised. And not only that, here giant cells are seen. Giant cells. Where do you see usually giant cells? Giant cells, epithelioid cells, macrophages. What they will form? Granulomas. Sir, here there is inflammation. But it's which type of inflammation? It's a granulomatous inflammation. Remember, sir, G for G, giant cell arteritis. It's an example, right? The giant cell arteritis on histology. Histology, it's an example of granulomatous inflammation or granulomatous arteritis. So granulomatous inflammation is going to be seen. Okay, now how to put the diagnosis? See, this is the temporal artery, sir. This is the temporal artery. Now what you need to do is, so you need to do microscopic examination first. The histology is microscopic only, no? So to take this blood vessel, first what you need to do? First you need to do the biopsy. You need to take this blood vessel, sir. Okay, so you need to do the biopsy of superficial superficial temporal artery. So biopsy of the superficial temporal artery. Now important point is, sir, how much artery you need to take? What should be the length of this biopsy piece? How much length you need to take the biopsy? So the optimal length is going to be somewhere between 3 to 5 centimeters. 3 to 5 centimeters. Why you need to take 3 to 5 centimeters? Or why 1 centimeter biopsy is not enough? Why it is not enough? Why you need to take 3 to 5 centimeters, such a large piece? 5 centimeters is this much, right? Why you need to take such a large piece of this temporal artery? It's because, see, there is inflammation, okay, the temporal arteries are involved, the superficial temporal artery is involved, okay. But do you think there is a continuous inflammation? There is not continuous inflammation. There is segmental inflammation, MCQ. So, right here, the giant cell arteritis, it's a segmental inflammation. Okay, there is a segmental inflammation of the temporal arteries. So, for example, if you take a small piece, okay, for example, if you take a small piece of artery, only 1 centimeter, maybe in that particular area, there is a chance that there is no inflammation. So, you will miss out the diagnosis. So, for that purpose, you need to take a large piece of temporal artery biopsy. Then what you will see? You will see the segmental inflammation, segmental granulomatous inflammation is going to be seen with the giant cells, epithelioid cells, okay, are present, sir. So granulomas are positive. Remember, granulomas are present, sir. Okay, so these are the important points which I want you to know. Even in this image, you can very clearly see the temporal artery biopsy, TAB. TAB means temporal artery biopsy. Temporal artery biopsy is performed in a patient in a case study. Okay, so that's a temporal artery biopsy. Now, we are done with the first step of vasculitis. The giant cell vasculitis or the temporal vasculitis is completed. Now, look here and just tell me, sir, can you tell me what is this vasculitis which I am showing you here? What is this vasculitis which I am showing you here? Any idea, guys? Any idea? Mir Mehran. Yeah, thank you very much. Fun mode. Saraha, Dr. Saraha. Fun mode, Varun Kashyap. What is this? Can you tell me, sir? Here, see, this is the arch of aorta. Okay, the bigger blood vessels, large blood vessels, the arch of aorta is getting involved. Okay, do you know what is this disease called as? So, this disease is Takayasu. Okay, Takayasu arthritis. Now, other important points, aka Takayasu arthritis, it is also called as, I have shown you which part is going to be affected, aortic arch. So, also called as aortic arch syndrome. Okay, this is also called as aortic arch syndrome. So, the aortic arch is going to be affected. Not only that aortic arch, see, from this aortic arch, the inflammation is going to spread to the blood vessels which are coming from the aortic arch. For example, look here, from this aortic arch, these blood vessels are coming out. Now, this inflammation will also spread into these blood vessels. Now, from this aortic arch, the inflammation may spread into the subclavian artery. Subclavian artery, we know the subclavian artery is going to continue as axillary artery. Axillary artery is going to continue as a brachial artery. Brachial artery is going to continue as the radial and ulnar arteries. So, inflammation is going to spread through these bigger arteries, larger arteries. So, when these blood vessels are now inflamed, the blood flow through this blood vessels is going to be greatly compromised. Less blood flow, inflamed blood vessels. So, when you try to measure the pulse, are you able to appreciate the pulse in the upper extremities? No. No, sir. Because the blood vessels are involved, the aortic arch is involved, the subclavian arteries are involved. Okay. So, now this disease is also called as aortic arch syndrome. One more name, that is pulseless disease. Okay, it's also called as a pulseless disease. Now, my questions to you, sir, this aortic arch syndrome, is it going to be seen in males or females? Males or females, sir? Again, females. Lucky males. Okay, we are all lucky, we are not getting these diseases. Okay, so they are going to be not getting in the sense, mainly it's going to occur in the females. So, females, but which age group? Which age group? Important. Less than 40 years. Okay, means younger females, 30 years, 35 years, 25 years. So, a younger female who is presented to your clinic, when you try to measure her pulse, the pulse is not there. There is very weak pulse, feeble pulse, pulseless patient. What do you think? What do you suspect? Young female, Takayasu arthritis, aortic arch syndrome. Okay, so now in one of the exams, this question was asked: most common blood vessel involved. The most common blood vessel involved. Say blood vessel. They are asking the blood vessel. It is subclavian artery. Okay, subclavian artery. If you have to pick one single best answer, it's the subclavian artery. Because of the involvement of the subclavian artery only, the pulse is not going to be properly felt. Okay, so what is the most common presentation? The most common presentation is going to be weaker pulse in upper extremities. Okay, weaker pulse in the upper extremities. Now, on microscopy, whenever you do microscopic examination, what you will see? Sir, is it a granulomatous vasculitis or is it a non-granulomatous vasculitis? You know, in the inflammation topic, we have discussed there are two types of inflammation: granulomatous inflammation, non-granulomatous inflammation. If there is presence of granulomas, then it is called as a granulomatous inflammation. Okay. So now tell me, sir, this one, the temporal or the giant cell arteritis. The temporal or the giant cell arteritis, yes, it is a granulomatous vasculitis. Now what about this? What about Takayasu? It is also granulomatous. It's also granulomatous vasculitis. So both the large vessel vasculitis, that is temporal arteritis as well as Takayasu, temporal Takayasu, both are granulomatous vasculitis. Temporal arteritis, superficial temporal artery is involved. In Takayasu arteritis, the subclavian artery is most commonly involved. Done. Okay, done. So large vessel vasculitis are completed, sir. So now let's strike here. So these two are completed. Temporal, Takayasu completed. Now after that, we have to start with what? We have to begin with the medium vessel vasculitis. Just as a recap, in medium vessel vasculitis, what do we have? We have polyarteritis nodosa, Kawasaki disease, and thromboangiitis obliterans, also called as Berger's disease. Okay, Berger, not burger, Berger. Okay. Now, see, whenever I used to think about the medium vessel vasculitis, the three types of medium vessel vasculitis, first thing that will come to my mind whenever I used to think about the polyarteritis nodosa, the first type in the medial vessel vasculitis, the polyarteritis nodosa. I used to think about this, plan B. So what is this plan B? Okay, we all have the plan B, right? Okay, if something goes wrong, plan A goes wrong, plan B, we all have the plan B. So what is this plan B? I used to remember something like this. This is my self-made mnemonic kind of thing. So PAN, polyarteritis nodosa. Multiple blood vessels are involved. Okay, like nodules, small nodules, blood vessels are involved. And then what is this B, sir? B. So this polyarteritis nodosa, this condition, it is associated with hepatitis B. The one vasculitis which is associated with the hepatitis B is PAN. So PAN B. I used to remember something like this. Plan B. Polyarteritis nodosa associated with hepatitis B surface antigen. Positivity will be seen. Hepatitis B surface antigen is positive in which type of vasculitis? Polyarteritis nodosa. Okay. Now look here. See what you are looking at here. So the inflammation is there, severe inflammation. So this is just not a granulomatous inflammation. This is a necrotizing inflammation. Necrosis. The tissue death is going to occur, sir. So it's a necrotizing vasculitis. Important points which you should know for your exam. So this, why it is occurring, we don't know the exact reason. Idiopathic. So it's an immune complex mediated vasculitis. True. Seen in whom? Seen in males, not in females. Seen in males, young males. Okay, not in female, I shouldn't say something like that. It's mainly seen in young males. See, 30% cases of the polyarteritis nodosa are associated with hepatitis B surface antigen. Okay, hepatitis B surface antigen is going to come positive. 30% of the polyarteritis nodosa, they are going to have surface antigen B positivity. Hepatitis B association, plan B, same thing. Okay, and these patients are also associated with hairy cell leukemias. Okay, they are also associated with the hairy cell leukemias. Now, see here in this condition, the one important I want you to know. So PAN, right? Polyarteritis nodosa. PAN. Polyarteritis nodosa. Multiple blood vessels are involved. But one blood vessel is not involved, sir. So what is that? Pulmonary arteries are not involved. I used to remember something like that. Okay, famous mnemonic, especially for the board exams, USML exams. So PAN means pulmonary artery not affected. All blood vessels are affected, but pulmonary blood vessels are usually spared. So that's the MCQ, sir. Pulmonary arteries are usually spared. What is the most common blood vessels which are involved then? Which blood vessels are involved most commonly? Renal blood vessels. Okay, so the renal blood vessels are most commonly going to be affected. Okay, renal blood vessels, the cerebral blood vessels are involved, but the renal blood vessels are most commonly involved. Okay, in this condition, polyarteritis nodosa, if you look at the kidneys, how the kidneys are looking like. So, are you able to appreciate the small petechial, like small hemorrhages? Okay, these are nothing but flea-bitten appearance. So these kidneys are having flea-bitten appearance. So flea-bitten appearance is seen in which type of vasculitis? Polyarteritis nodosa. It is also seen in other vasculitis also, Hematuria and purpura, but later we will discuss. Okay, in the next slide we will discuss. So tell me, what are the important points? How you should remember the polyarteritis nodosa? See, the mnemonic which I gave you is plan B. Plan B for PLAN. Polyarteritis nodosa associated with hepatitis B. Also associated with hairy cell leukemia. Okay, done, sir. PAN. Polyarteritis nodosa, just remember it like pulmonary artery not involved. All blood vessels are involved, but pulmonary arteries are not involved. Then what are the most common blood vessels involved? The most common blood vessels that are involved are kidneys. Okay, the renal arteries are going to be most commonly involved. So because of the involvement of the kidneys, what kind of appearance is seen? Flea-bitten appearance is seen. Usually in this condition there is no hematuria. Hematuria is not seen. Okay, nephritic syndrome, hematuria are not seen. Just what you are going to have is the flea-bitten appearance of the kidneys. Okay. Next, sir, is it a granulomatous vasculitis? See, I have told you in the beginning itself. See, it's not just a granulomatous vasculitis, it's a necrotizing. It's a necrotizing vasculitis. Necrosis is happening. Okay, so see, necrotizing transmural inflammation. The entire blood vessels, there is a transmural. All the vessel wall, all the layers in the vessel wall are going to be affected. Transmural inflammation with the necrosis. Necrosis. Okay, so even in the cell injury topic, I have explained you. Sir, in polyarteritis nodosa, there is fibrinoid necrosis. Okay, there is which type of necrosis? The blood vessels are dying. The blood vessels are dying, sir, necrotizing. Which type of necrosis? Coagulative, liquefactive, caseous. Which type of necrosis? Fibrinoid necrosis. Never ever forget this MCQ. Okay, so done, sir. Now you can ask me, sir, why it is called as polyarteritis nodosa? Polyarteritis means multiple blood vessels are involved. Then what is that nodosa? See, if you look at this arteriogram, okay, this is the arteriogram which I am showing you here. Now, are you able to appreciate this, like, nodular appearance in the blood vessels? Okay, nodular appearance. So this is something called as a string of bead appearance. Okay, this is something called as a string of bead appearance, a string of beads. So that's why the name nodosa, like the small nodules. So polyarteritis nodosa. Okay, string of bead appearance is going to be seen. Okay, string of beads appearance. Renal arteries are going to be most commonly affected. Now, in your exams, especially in EPG exam and FMG exams, they can ask you, sir, flea-bitten kidneys are associated with which conditions? Now you know, sir, flea-bitten kidneys are seen in which type of vasculitis? It's seen in polyarteritis nodosa, medium vessel vasculitis. Guys, do you have any other idea? Do you have any other idea where this flea-bitten kidneys is going to be seen? Come on, fun mode, Kunal. You are asking, Kunal, when we will be teaching the neoplasia? After this we will teach the neoplasia. Okay, that one general topic is yeah, I just want to take a deviation from the general topics. Continuously we are doing the general topics, right? The cell injury, inflammation, genetics. I just want to make it little interesting, because the systems are going to be little interesting, right? We can make more integrations. We are actually doctors, so we should be dealing with the systems. So that's why. Okay, we'll discuss about neoplasia also. Don't worry. Okay. Next, guys, can you tell me? In which conditions? No idea. Oh my God, guys, bad guys. You're bad guys. You're not answering. Okay, you don't know. So look here, malignant hypertension. So malignant hypertension is associated with flea-bitten kidney. I have taken it from the internet, but yeah, important. So malignant hypertension, polyarteritis nodosa. And look, even Hematuria purpura. Okay, Hematuria purpura we will discuss. This is also a vasculitis. Okay, here also you will see the vasculitis, Hematuria purpura. Okay, Hematuria purpura, infective endocarditis, hemolytic uremic syndrome, thrombotic thrombocytopenic purpura, rapidly progressive glomerulonephritis. You need to by heart them, sir. You need to by heart them. There is no doubt. So you can get an MCQ from here. Image based question they can ask you. Okay, image based question. See, that's a petechial appearance. Okay, on the kidney. Now tell me, flea-bitten kidneys are associated with, just answer whatever you can. Malignant hypertension, okay, hemolytic uremic syndrome, polyarteritis nodosa, Hematuria purpura, rapidly progressive glomerulonephritis, infective endocarditis. Enough. If you can remember this much, it's more than enough, sir. Okay, done. After this, let's discuss about the next type of vasculitis. The next type of vasculitis. First, before that, now put a cross mark here. What we have completed? We have completed polyarteritis nodosa. Done. Now we have to discuss about Kawasaki diseases. Whenever I think about a Kawasaki disease, I used to think something like this. Okay, Kawasaki. What is that Kawasaki? Our favorite bike. Okay, boy's favorite. What is that? Kawasaki bike, right? See, Kawasaki Ninja bike. Okay, see, it's a Kawasaki bike, sir. Okay. Now there is a boy. Okay, there is a boy who is riding on this Kawasaki bike, but this boy is not a good boy. He's a naughty boy. Okay, bad boy. Why bad boy? Because he's having what? He's carrying something. What is that, sir? What he's carrying? It's a Corona beer. Corona beer. Okay. So now whenever this boy, little boy, whenever he take this Corona beer and whenever he goes on a ride with Kawasaki bike, what happens? Definitely there is going to be a crash. Immediately there is going to be a crash, sir. Okay, there is going to be a crash. So I used to remember something like this. Okay, I used to remember something like this. So Kawasaki bike, a child with a Corona beer is going to have a crash. Is going to have a crash, sir. So he is now crying. He's crying. Crash. Okay. So now why I gave you all this story? A story kind of thing. Because see, so the Kawasaki disease. Look, let's write one by one point. So this Kawasaki disease, it's going to occur in whom? It's going to occur in 40 years or 50 years or 20 years? Young males and young females? No. It's going to be seen in children, sir. It's going to be seen in children. So it's a pediatric vasculitis. The first point is it's a pediatric vasculitis. Seen in whom? Small child, that is less than 4 years of age. Okay, less than 4 years of age. So why it is happening? No idea. No one doesn't know why it exactly happens. Okay, exactly why it is happening, no one don't know the idea. So this Kawasaki disease, also called as the mucocutaneous lymph node syndrome. Okay, mucocutaneous lymph node syndrome, sir. Which means the mucous membranes, the skin involvement will be there, mucous membranes, the skin involvement will be there, and the lymph node involvement will be there. Okay, mucosal membranes are going to peel off. I will show you, the mucosal membranes are going to peel off. There will be skin peeling, sir. And the lymph nodes are going to be enlarged. Lymphadenopathy is going to be seen. Lymphadenopathy. Okay. So one by one, let's discuss one by one. So, see, mucous membranes are going to be involved. That's why mucocutaneous disease, inflammation is going to be there. So, what is the diagnosis? What is the diagnosis? Let me tell you something. How to put the diagnosis even before diagnosis. So, see, here I have shown you the children with that Kawasaki bike. See, why a child is riding this Kawasaki bike? It should remind you, it's going to occur for the children. Kawasaki disease is going to be seen in the children. Pediatric vasculitis, less than 4 years of age. Then why he is having this Corona beer? Why he is having this Corona beer? The Corona beer here stands for his coronary arteries, the most common blood vessel that is going to be affected. The most common blood vessel that is going to be affected is coronary arteries. Coronary arteries. Okay. Now, okay, sir. Well, now what happened? He is having a crash. He is having a crash. So what exactly this crash stands for? That's a diagnosis. That's for the diagnosis. Dekho, how to put the diagnosis of this Kawasaki disease? The patient is going to have, see, CRASH, right? CRASH, crash. See, conjunctivitis. The patient is going to have the conjunctivitis. Okay, bilateral, non-suppurative conjunctivitis. Okay, there will be a rash. Okay, polymorphous rash. Okay, polymorphous to desquamative. Polymorphous, just remember the rash. The patient is going to have the rash on the skin. Okay. Next, adenopathy. CRA. C completed. Okay, C completed. R for rash. A for adenopathy, lymphadenopathy. Lymph nodes are going to be enlarged. Next, S, strawberry tongue. Okay, if you look at the tongue, his tongue is going to look like a strawberry. Okay, strawberry because of the mucosal involvement. Mucositis, inflammation of the mucosa. Mucositis. Okay, oral mucositis. Hand-foot involvement. So what is this hand-foot involvement? There will be edema. Okay, erythema. Okay, skin involvement, right? Edema and erythema. The skin involvement, erythema. The hands are going to be reddish in color. Okay, so hand and foot involvement will be there. Edematous hands will be there. Okay, so this is crash, sir. C-R-A-S-H. Crash. And I have explained you what is the most common cause of death. The most common cause of death in this patients is coronary artery disease. Why coronary artery disease? The coronary artery disease is because of the involvement of the coronary arteries. The most common blood vessels that are involved are the coronary arteries. So coronary artery involvement can lead to myocardial infarction, and that myocardial infarction in such a small baby can lead to death. So when a small boy, if he is having myocardial infarction, then you should think about maybe that boy might be suffering with Kawasaki disease. Okay, coronary arteries are most commonly involved. So now look at this image. What are the points which you need to know? See, dekho here, the boy is having a rash, and hand and foot involvement, sir. See, the skin is peeling off. Okay, so the skin is peeling off, the skin and the hand and foot involvement. Now, if you look at the eyes, there is bilateral conjunctivitis, red color conjunctivitis. Now, what is this? Oral mucositis. The mucus, the layer, the mucosa is going to peel off, and here you can very clearly see the lymphadenopathy. Okay, the lymph nodes are going to be enlarged. In the small boy, the lymph nodes, lymphadenopathy is seen, sir. And strawberry tongue. So now, come on, just a recap of Kawasaki disease. First, Kawasaki disease. Kawasaki disease is a type of medium vessel vasculitis, large vessel vasculitis or small vessel vasculitis. It's an example of medium vessel vasculitis. Done. What you should think, a small boy with a corona beer is going on a Kawasaki bike, made a crash. So from this story, what you should know, sir, seen in children, pediatric vasculitis, less than 4 years of age, Okay, most common blood vessel involved, coronary arteries, most common cause of death, myocardial infarction. How to put the diagnosis? The diagnosis, how we can establish the diagnosis is, sir, I have shown you 5 features, CRASH. Out of these 5 features, if you have any 4 of the following, okay, fever plus any 4 of the following, what are those 5? CRASH, C for conjunctivitis, R for rash, A for adenopathy, lymphadenopathy, S for strawberry tongue, oral mucositis, and H for hand and foot involvement. Answer. Done. Now, if you take the blood sample from these fellows, okay, so what you can find in the lab is, so these patients are going to have anti-endothelial antibodies. Okay, anti-endothelial antibodies are going to be seen in these persons. Okay, anti-endothelial antibodies are going to be seen. Done, sir. So Kawasaki is also completed. So let's put a cross mark for the Kawasaki. Kawasaki, ho gaya. Done. We are done with the Kawasaki. Now next disease is thromboangiitis obliterans. In the name itself is there, they go thrombus, angiitis, inflammation of the blood vessels, and obliterans, the blood vessel is going to be obliterated, completely blocked. Okay, so now the blood vessel is completely blocked. There is going to be ischemia followed by infarction followed by total necrosis. So let me show you. So they go here. Now what is this, sir? What you are able to see here? The patient is having amputation of his fingers, auto amputation of the fingers. Why? Because the blood vessel supplying this area is totally blocked. The blood vessels are blocked because of the thrombus. So thromboangiitis obliterans. There is infarction leading to necrosis. This is dry gangrene, right? Dry gangrene because of decrease in the blood flow. Arterial occlusion. This is called as auto amputation. Very, very important MCQ. Auto amputation of the fingers is seen in which type of vasculitis? It is seen in thromboangiitis obliterans, also called as Burgess disease. In whom you will see this? In whom we will actually see this, sir? See, dekho, it is seen in heavy smokers. We will go one by one. So thromboangiitis obliterans, also called as a Burgess disease, seen in young. Why? Because young people are the ones who smokes most. Okay, young people. So 35 years. Okay, heavy smokers are seen in heavy smokers. It is associated with what? Associated with something called as Raynaud's phenomena. Sir. So this is what is the Raynaud's phenomena. See, this area became pale. Okay, this area became pale. Why? Because the blood supply got lost. Okay, associated with the Raynaud's phenomena. To that area, the blood supply is lost, so it becomes pale. Okay. Okay, done, sir. Now, what are the clinical features? So these patients are going to have intermittent claudication, intermittent pain because the blood supply is decreasing. So now very, very important point. If in a question, if they mention you, see, jaw claudication is the most specific sign seen in temporal arteritis or giant cell arteritis. Okay, but here in thromboangiitis obliterans, the patients are going to have intermittent claudication. Okay, so when he is walking, he is going to have a severe pain. When he takes rest, again pain is going to be subsided. Okay, so intermittent claudication, that is going to be relieved with rest. Okay, now what else I want you to know here is, so look, in this one condition, in this one type of vasculitis, thromboangiitis obliterans, inflammation is there, thromboangiitis. Angiitis means inflammation of the blood vessels. Which blood vessels? Arteries or veins? See, dekho, so here the arteries are going to be affected. There is inflammation of the arteries, true. There is inflammation of the veins. So veins can be blocked with thrombi. Okay, the arteries can be obliterated. Okay, arteries can be obliterated. Veins can be obliterated. And what happens in this condition is the entire neurovascular bundle, that is arteries, veins and nerves, all these three are going to be affected with inflammation. Arterial inflammation, arteritis. Okay, even the veins are going to be affected with inflammation, as well as this inflammation even spread to the surrounding nerves. So the entire neurovascular bundle is affected, but MCQ in your exam, the lymphatic blood vessels are usually spared. The lymphatics are not affected, sir. Lymphatics are not affected. So as a doctor, we need to clear the exam. First, that's our primary motive. So what we need to know? See, simple. Thromboangiitis obliterans, medium vessel vasculitis, also called as Burgess disease, associated with heavy smokers, seen in heavy smokers, young males 35 years of age, associated with Raynaud's phenomena, Okay, there will be blanching. Okay, that's the Raynaud's phenomena, sir. So, in which type of vasculitis the entire neurovascular bundle is affected? That's the arterial involvement, veins involvement, as well as the nerve involvement. That is the thromboangiitis obliterans. Okay, lymphatics are affected. Lymphatics are usually spared. And what you will see, there is autoamputation of the fingers. You can very clearly see here, this is a blood vessel. Okay, the wraps of the blood vessel. So the entire lumen is blocked with the thrombus. This is a thrombus. Okay, with lot of infection as well as inflammatory. See, the lot of inflammatory cells are seen. Okay, see, demonstrate a vessel completely occluded by inflammatory thrombus. Okay, and even you can see the micro abscess. Okay, infection, micro abscess. Okay, so done. Is that okay? Now shall we have a recap? Just a recap, important topics. Okay, now just close your eyes, or you just put it in the chat box. Sir. Come on, buddies. Tell me, how many types of vasculitis are there? Just how many types of vasculitis are there? 3 types of vasculitis. Okay, 3 types of vasculitis are there. What are they? Large vessel, medium vessel, and small vessel vasculitis. Okay, so vasculitis are associated with which type of antibody? So vasculitis are associated, especially small vessel vasculitis are associated with ANCA antibodies. How many types of ANCA are there? There is P ANCA and C ANCA. Okay, P ANCA and C ANCA, sir. Done. Next, P ANCA and C ANCA completed. Next, what are the 2 types of large vessel vasculitis? The 2 types of large vessel vasculitis are temporal arteritis or giant cell arteritis, also temporal arteritis, giant cell arteritis, and Takayasu arteritis. Which disease is called as pulseless disease? Takayasu arteritis. Okay, both the temporal and Takayasu, they are granulomatous vasculitis. Both are granulomatous vasculitis. Now, which vasculitis which we have studied now so far is a necrotizing vasculitis? Sir, necrotizing vasculitis is polyarteritis nodosa. Polyarteritis nodosa is an example of necrotizing vasculitis. So, it's a necrotizing vasculitis. Okay, which type of necrosis? Fibrinoid necrosis. Okay. Next. So, in Kawasaki disease, what is the most common blood vessel that is affected? Coronary arteries are affected. So, what is the most common cause of death? Myocardial infarction in such a young boy. What are the clinical features that are seen? CRASH crash, conjunctivitis, rash, adenopathy, strawberry tongue, and hand and foot involvement. Which antibodies are seen? Anti-endothelial antibodies are seen in Kawasaki disease. Okay, done, sir. Now, in which type of vasculitis? We have studied about flea-bitten appearance of the kidneys. The flea-bitten appearance of the kidneys are seen with polyarteritis nodosa. Okay, done, sir. Done. Autoamputation is seen with Burgess disease. Burgess disease is also called as thromboangiitis obliterans, associated with Raynaud's phenomena, seen in heavy smokers. Okay. Now, after this, let's discuss about the small vessel vasculitis. Now, we are going to start with the small vessel vasculitis. Now, look here, what is small vessel vasculitis? First small vessel vasculitis that we are going to discuss. The first small vessel vasculitis that I am going to discuss is Wegener's. Okay, Wegener's granulomatosis. Okay, Wegener's granulomatosis. Now, I have asked you to remember Wegener's granulomatosis as Wegener's. Okay, Wegener's. Why Wegener's? C ANCA positivity is seen. C ANCA, 75% of the cases. Okay, 75% of the cases are associated with the C ANCA. Remember that. We will discuss about that later. Now, one by one. So, this Wegener's granulomatosis is also called as granulomatosis with polyangiitis. True. The granulomatosis with polyangiitis. This is also same. Not only polyarteritis nodosa. This is also necrotizing vasculitis. So, tell me 2 necrotizing vasculitis. One is polyarteritis nodosa and Wegener's granulomatosis. Wegener's granulomatosis is also called as granulomatosis with polyangiitis. Now, in the name itself, it says, granulomatosis. So, it is granulomatous vasculitis along with necrotizing. Granulomatous vasculitis. Inflammation is granulomatous inflammation, but at the end of the day, necrosis is happening. The blood vessels will undergo necrosis. The tissue will undergo necrosis. Okay, so necrotizing vasculitis as well as granulomatous, both true. Now, in this vasculitis, which organs are most commonly affected? Very important MCQ, sir. 3 organs are going to be most commonly affected: nose, lungs, and kidneys. Okay, nose, lungs, and kidney involvement is going to be same. Nose, lungs, and kidneys. See, lungs and kidneys are affected, sir. Now, if my lungs are affected, okay, because of this vasculitis, I will be having hemoptysis. When I am coughing, I will be having hemoptysis. Blood is going to come out in the cough. And when my kidneys are going to be affected, I am going to have the hematuria, blood coming out in the urine. So these patients are going to have hemoptysis with hematuria. Hemoptysis with hematuria, sir. This is the same hemoptysis and hematuria also seen in Goodpasture syndrome. There is a lung pathology we will study. Hemoptysis and hematuria. Whenever you see this combo sir, hemoptysis and hematuria, 99% of the students will think about Goodpasture syndrome. They will think about the Goodpasture syndrome. But not only Goodpasture syndrome, even in this Wegener's granulomatosis also, lung involvement will be there and kidney involvement will be there, and nose involvement also. So what are the clinical features? We'll discuss one by one. Look at this clinical features. Sir, the nose involvement, nose and the paranasal sinus is also involved. Nose and the paranasal sinus is involved. So these patients are generally going to have the runny nose. Okay, runny nose. There is a rupture of the nasal septum because of the vasculitis. The nasal septum, the nasal bridge, the nasal septum, not bridge, the nasal septum is going to be going to have the necrosis in the nasal septum, going to form the perforation, going to have the perforation. So there is rupture of the nasal septum leading to perforation. Rupture of the nasal septum, true. Runny nose is going to be there, and chronic sinusitis, sinus involvement leading to chronic sinusitis. Okay, these are all the nose and paranasal sinus involvement. Apart from this, also I have explained to you. So there is hemoptysis, lung involvement. Okay, hemoptysis. Kidney involvement is, see, dekho, hematuria, hemoptysis and hematuria. You can ask me why hematuria, sir. See, imagine I am the patient who is suffering with, I am the patient who is suffering with Wegener's granulomatosis, sir. I am the patient. Okay, example I am giving you. I am the patient who is suffering with Wegener's granulomatosis. Now, I will develop rapidly progressive glomerulonephritis or crescentic glomerulonephritis. Glomerulonephritis, inflammation of the glomerulus. What is glomerulus? Glomerulus is nothing but the blood vessels. Okay, these blood vessels only. So if I have Wegener's granulomatosis, my kidneys are going to have the nephritic syndrome. Nephritis, glomerulonephritis is going to be there. Okay, so that's why, yeah, these patients are going to have crescentic glomerulonephritis or rapidly progressive glomerulonephritis. That is the one causing hematuria. Whenever there is hematuria, RBCs are coming out in the urine. So in the urine, you can see RBC casts. Okay, RBC casts, sir. So now tell me, what are the important points about the Wegener's granulomatosis? Remember it like Wegener, C anchor positivity, small vessel vasculitis. 3 organ systems are going to be involved. Nose and paranasal sinus is involved, leading to runny nose and chronic sinusitis. Lung involvement is going to show hemoptysis, cough and dyspnea will be there. Hemoptysis is important. And kidney involvement, that is the chronic, it's the crescentic glomerulonephritis or rapidly progressive glomerulonephritis is going to be occurring in the kidneys that will lead to hematuria with RBC casts which are seen in the urine. Done, sir. Now, if you look at this, patients with the Wegener's granulomatosis, they are going to have saddle nose deformity. Saddle shaped nose is going to be there. Okay, saddle, you know, right? On the horse back, you are going to have a saddle. You are going to sit on that saddle. Okay, so like that. Saddle nose is going to be there. And if you look at their gums, okay, if you look at their gums, they will be having strawberry gums, strawberry gingivitis, strawberry gums. Wait, where we have studied about the strawberry, tongue? Come on guys, tell me, where we have studied about the strawberry tongue? Come on, fun mode. Where we have studied about the strawberry tongue? Fun mode, Reen, Varun Kashyap, Kunal. Any idea where we have studied about the strawberry tongue? Any idea, guys? Kawasaki, yes, excellent, fun mode. It's a Kawasaki disease, strawberry tongue. But here what you are saying, this is not the strawberry tongue, this is strawberry gingivitis, strawberry gums, because of the inflammation of the blood vessels. Now, can you tell me where you will see the strawberry vagina? The strawberry vagina is seen in, or the strawberry cervix. Okay. In which condition, sir? Good day, greetings. Yes, Rishiraj, good day. Strawberry vagina, sir. An angry looking cervix. We'll call it as an angry looking cervix. One more name is there, which is also called as Culpitis macularis. Okay, Culpitis macularis, strawberry vagina or strawberry cervix, it is seen in. Any idea? One you don't know about that? Trichomonas vaginalis. Trichomonas vaginalis. Okay, so there is an infection called as trichomoniasis. Excellent fun word, trichomoniasis. Okay, in trichomoniasis there is going to be strawberry cervix. Okay, done. So in pregnancy granulomatosis, necrotizing vasculitis, granulomatous vasculitis, small vessel vasculitis, nose, lungs, kidney involvement, hemoptysis with hematuria, saddle nose deformity will be seen, as well as strawberry gingivitis. Strawberry gingivitis, sir. Okay, done. Now, देखो, so in one of the PG exam, this question was asked, what is the Wegener's triad? In Wegener's granulomatosis, there are the triad of symptoms. What are the triad of symptoms? Yes, vasculitis is there, small vessel vasculitis is there, true. Upper respiratory tract and lower respiratory tract infections can be there. Okay, respiratory tract is chronic sinusitis because of the upper respiratory tract infection. Okay, and lower respiratory tract infection can lead to hemoptysis and glomerulonephritis. I have discussed rapidly RPG and rapidly progressive glomerulonephritis, also called as crescentic glomerulonephritis, leading to hematuria. So these are the three things which are present in the triad. So Wegener's triad include vasculitis, small vessel vasculitis with upper and lower respiratory tract infections and glomerulonephritis. Kidney involvement, lung involvement and vessel involvement. Wegener's triad. See, question which I want you to know is, what is the treatment for this one condition, sir? Okay, this is something really very important. So what is the treatment? Guys, do you have any idea what is the treatment in this condition? What is the treatment for this Wegener's granulomatosis? What is the treatment for the Wegener's granulomatosis? Any idea? It starts with the letter C. It starts with the letter C. Is cyclophosphamide. It's a cyclophosphamide, sir. It's a drug. So cyclophosphamide is a treatment that we is a drug which we use for the treatment of Wegener's granulomatosis. But whenever you use pharma integration, whenever you use the cyclophosphamide, what's going to be the side effect? What's going to be the side effect, sir? The side effect is going to be hemorrhagic cystitis. Hemorrhagic cystitis. Okay, they're going to be hemorrhagic cystitis. Inflammation of the bladder, urinary bladder. Okay. Now let me tell you why exactly it happens is, so if you give cyclophosphamide or ifosfamide, say ifosfamide or cyclophosphamide, you are giving it, sir. You are giving the drug. Now in the body, this is cyclophosphamide and ifosfamide, these are the drugs. Remember, same cyclophosphamide, okay, and ifosfamide here. Cyclophosphamide and ifosfamide, they are going to be broken down. Okay, they are going to be broken down in our body, sir. Into what? Into a substance called as acrolein. This is MCQ. This is MCQ. So the cyclophosphamide, whatever you have given, the cyclophosphamide is going to be broken down into a substance called as acrolein. Okay, in the body, it is something toxic to our body, sir. It's a toxic metabolite. Okay, it's a toxic metabolite. What it will do is, this acrolein, it will cause irritation to the bladder. It will cause irritation to the bladder. So the bladder is getting inflamed and it is bleeding, sir. Now, okay, it's bleeding. There is inflammation followed by bleeding. So bleeding. So cystitis, hemorrhagic. Okay, hemorrhagic means bloody urine. Okay, bloody urine is going to come out. Hemorrhagic cystitis, inflammation of the bladder. Because of what? Because of the acrolein. Acrolein is the byproduct, or acrolein is the metabolite of cyclophosphamide or ifosfamide. Done. Okay, done, sir. So Wegener's granulomatosis is also completed. Important point we have forgot. What is that? 75% of the cases are associated with C and K, and 25% of the cases are associated with P and K. C and K and P and K, sir. Done. Now after this, let's discuss about microscopic polyangiitis. Microscopic polyangiitis. See, this microscopic polyangiitis, again, small vessel vasculitis, true. Okay. It is also called as microscopic pan. This is microscopic polyangiitis. Right now I am talking about microscopic polyangiitis. But what is the other name? The other name is called as microscopic pan. Microscopic polyarteritis nodosa. Okay. So, aka microscopic pan. One more name is there. It is also called as leukocytoclastic vasculitis, MCQ. So, what are the three names? Microscopic polyangiitis, or microscopic pan, or leukocytoclastic vasculitis. Okay. Now, what are the differences? Okay, what are the differences between pan, that is polyarteritis nodosa, the medium vessel vasculitis, and the microscopic pan, that is microscopic polyangiitis? What are the differences? Dekho, microscopic pan and pan. What are the differences? See, in pan, the P anca is negative, sir. P anca is negative. There is no such thing as anca in pan. But here in microscopic polyangiitis, in the beginning I have explained you. In microscopic polyangiitis, the P anca is going to be positive. Okay, the P anca is going to be positive, sir. One is a medium vessel vasculitis, the other is a small vessel vasculitis. Okay, so now third thing which we are going to discuss. So even this is an example of, it is also going to cause fibrinoid necrosis. Where we have seen the necrosis? We have seen the necrosis 3 places so far. Okay, with this, what are they? Polyarteritis nodosa, Wegener's granulomatosis. Wegener's is also an example of necrotizing vasculitis, and microscopic polyangiitis or microscopic pan. Microscopic pan is also an example of fibrinoid, like is going to cause a necrosis, fibrinoid necrosis, sir. Okay, but this is non-granulomatous. It's non-granulomatous. No granulomas are seen. Okay. Now important point. See, very important. Both pan and microscopic pan. Okay, both polyarteritis nodosa and microscopic pan. Microscopic pan means microscopic polyangiitis. Both these are non-granulomatous. Both are non-granulomatous. Both are non-granulomatous. There is no granuloma formation. Okay, and in this microscopic pan, there is going to be fibrinoid necrosis. Now, even in this condition, microscopic polyangiitis, lungs and kidneys are going to be involved. Lungs and kidney involvement, sir. Okay, lungs and kidney involvement. So even in this condition, the patient is going to have hemoptysis and hematuria. Okay, so hemoptysis and hematuria are seen in Wegener's granulomatosis. Hemoptysis, hematuria is seen in Wegener's granulomatosis. Even in this microscopic polyangiitis, again hemoptysis and hematuria are seen. But how to differentiate? There are many features. See, in Wegener's granulomatosis, the patient is going to have they will give you in your question saddle-like deformity. They will give you the gingivitis, the strawberry gingivitis, they can explain you, and the patient is going to have the chronic sinusitis. Okay, chronic sinusitis, or the cough is going to be there. So there are multiple things which they can add you. They can say something like there is presence of the C anca in the blood. So you can differentiate, sir. Based on the other features, you should differentiate, because both in Wegener's granulomatosis as well as microscopic polyangiitis, in both the conditions, hemoptysis and hematuria are seen. Okay. Next, after this, look here and tell me, sir, what you are looking at here, just image what you are looking at here. Sir, you can very clearly see the purpura, sir. These are the bleeding. Okay, these are the bleeding spots. There is skin bleeding, sir, bleeding into the skin. So these are the purpura. You can palpate them also. You can actually palpate them. Okay, they are little elevated, so you can actually palpate them. They are the palpable purpura, sir. Now my question to you, sir, is this a small kid or an adult? Whatever I am showing you, see, he is wearing a small, small diaper kind of thing. Okay, this is definitely a child. Okay, so now let me write one by one important point. The condition which I am going to discuss here, it is called as Henoch-Schullen purpura. Okay, Henoch-Schullen purpura. What is the other name? Also called as anaphylactoid. Okay, anaphylactoid purpura. Okay, anaphylactoid purpura. Okay, anaphylaxis. Okay, anaphylaxis. Okay, means allergy. Anaphylaxis, allergy. See, this is the most common MCQ. Most common vasculitis in children. So now you know two types of vasculitis that can come in in children. One is the most common vasculitis that can come in children is Henoch-Schullen purpura, sir. Henoch-Schullen purpura. And also we have discussed the Kawasaki disease. The Kawasaki disease is also going to occur in a child less than 4 years of age, the coronary artery involvement. Okay, so the most common vasculitis in the children is Henoch-Schullen purpura. What happens here is, sir, the IgA antibodies, okay, the IgA antibodies are going to deposit in vessels. Okay, so there will be high levels of IgA antibodies. there is high level of IgA antibodies that are getting produced in the body. These IgA antibodies, they will start to deposit in the blood vessel, leading to inflammation. Okay, the vessels are now going to start the inflammation, sir. Now, what are the clinical features, these patients? So, what are the clinical features that these patients are going to have? See, I used to remember like HSP, there is a mnemonic, sir, HSP. Hematuria purpura, HSP will be hinge pain. What is this hinge pain, sir? Hinge, like you know a thing, right? Hinge means joints, hinge joint, a type of synovial joint. So that is arthralgias. Okay, arthralgias, sir. Okay, hinge joint. Okay, arthralgias, pain in the joints. Yes. What is this S for? The patients are going to have stomach pain. Stomach pain. So why stomach pain? Because these patients, they will develop into susception. Okay, intussusception. I hope you already know what exactly is intussusception. If you don't know, just Google it and check later. Intussusception means one part of intestine, it will go into the other part of intestine. This is something called as a telescoping. You know the telescope, right? When you just take out the telescope, okay, one part will insert in the other, like you know the telescoping thing. So in the same way, one part of the intestine, it will herniate into the other part. This is called as intussusception. So which type of vasculitis is associated with intussusception? It is henostolen purpura. So the patients are going to have arthralgias, intussusception, and last P for palpable purpura. Okay, palpable purpura are going to be seen, sir. See, this purpura is not because of deficiency in the platelets. See, if there is a deficiency of the platelets, definitely there will be bleeding into the skin. Okay, that's a total different thing, sir. This is not because of the deficiency of the platelets. This bleeding is not because of the platelets. This palpable purpura are not because of the platelet problem. This is because of the vasculitis. The blood vessels are getting inflamed. The blood vessels are undergoing damage. That's causing the leaking of blood into the skin. That's what's causing the purpura. Okay. So purpura, it is because of vessels, inflammation of the vessels, not because of the platelets. Okay, not because of the platelets. Next, what else you will see? So, image based questions, palpable purpura on the buttocks, they will give you. Many of the exams, especially in the USMLE exams, they will give you this palpable purpura on the buttocks in a child. What is the diagnosis? Henostolen purpura, most common vasculitis in the children. Okay, it's also a pediatric vasculitis. Okay. Now, what you will see, sir, in these patients, lab diagnosis. Okay, in the labs, there will be thrombocytosis, which means the platelet levels are going to be elevated. Why? Because they are having more and more bleeding. To make the blood clots, the platelet count is going to be increased. Thrombocytosis, sir. Okay, not the thrombocytopenia, it's the thrombocytosis is going to be seen. Not only that, second thing, they are going to have elevated levels of IgA antibodies. High levels of IgA antibodies. High IgA antibodies are there. That's the problem. That's IgA antibody deposition in the vessels is causing the inflammation in the vessels. That's causing the vasculitis, sir. Okay, done. So henostolen purpura is also completed. What we have completed in the small vessel vasculitis? In the topic of small vessel vasculitis, we have done with the Wegener's granulomatosis. We have completed microscopic polyangiitis, also called as microscopic pan. Now we have completed the henostolen purpura. Next, discuss about Churg-Strauss syndrome. Okay, Churg-Strauss syndrome, sir. What are the important points which you should know regarding the Churg-Strauss syndrome? Churg-Strauss, do you have any idea? It's also called as allergic granulomatosis with polyangiitis. Important. Okay, allergic. This is the keyword, sir. Which type of vasculitis is associated with allergy? Churg-Strauss syndrome. Allergic. Okay, so allergic granulomatosis with polyangiitis. So in these patients, okay, all the allergy symptoms are going to be seen. So usually the clinical features in these patients are going to be rhinitis. Okay, there will be allergic rhinitis. That's the cold. So allergic rhinitis is going to be seen, and it's also associated with other allergies like allergic asthma. Okay, allergic asthma is going to be seen, and so if I am the person, okay, who is suffering with allergies, actually in reality I am having the allergies. Okay, now if you take my the complete blood picture, you'll be seeing eosinophilia. Okay, I have high levels of eosinophils in my blood. Okay, so even in this patient, it's a Church-Strass syndrome, it's a allergic vasculitis. All right, so the eosinophils are going to be more hyper eosinophilia. Okay, so there will be hyper eosinophilia. So the eosinophil levels, the eosinophil count is going to be more. So peripheral eosinophilia is going to be seen, allergic asthma is going to be seen, allergic rhinitis are going to be seen. Okay, so it's a small vessel vasculitis associated with the allergies. Allergies, done. Now, one MCQ, what is the most common cause of death? Any idea, guys? Most common cause of death? So this eosinophilic infiltrate. Okay, these eosinophils, they will infiltrate. Who infiltrate? Eosinophils. Eosinophils infiltrate the heart's myocardium. So there will be congestive heart failure. That can lead to congestive heart failure, and that's the cause of death. So the most common cause of death in Church-Strass syndrome is congestive heart failure. Congestive heart failure. Done. So with this, all the types of vasculitis are completed. All types of vasculitis are completed. Now, just the summary, sir. Let's see a summary. Summary of the vasculitis. Important point, large vessel vasculitis includes giant cell arteritis and tachyarteritis. Giant cell arteritis, more than 50 years, arteries of the head, that's that superficial temporal artery that is affected, sir. And in tachyarteritis, females are affected, less than 40 years of age. This tachyarteritis is also called as a pulseless disease. What is the most common blood vessel affected? That is the subclavian artery. The medium vessel vasculitis. Medium vessel vasculitis includes 3: polyarteritis nodosa, Kawasaki disease, and thromboangiitis obliterans, also called as a Berger disease, not burger. Here it is wrongly, it's a mistake. Okay, this is Berger. Okay, B-U-E-R, Berger. Okay, so Berger disease. See, polyarteritis nodosa, young adults, widespread. See, polyarteritis, it, associated with hepatitis B, hairy cell leukemia, pulmonary arteries are not affected, necrotizing vasculitis. Most common blood vessels involved are the kidneys. Renal arteries are going to be most commonly affected. Sir, Kawasaki disease, less than 4 years age. Coronary artery disease is going to be seen. Coronary arteries are going to be affected. Lymphadenopathy is going to be seen. Mucocutaneous lymph node syndrome. And Berger disease, males, chronic smokers, extremities will show Raynaud's phenomena and auto amputation. Now, small vessel vasculitis, Wegener's. I have asked you to remember it like Wegener. C-ANCA positivity is going to be seen. Lung and kidney involvement. Nose, lung, kidney. Saddle nose deformity is going to be seen. And strawberry gingivitis. Done. Church-Strass is allergic. Eosinophilia, peripheral eosinophilia. Asthma is going to be seen. Rhinitis is going to be seen. Most common cause of death is congestive heart failure. Okay, lung involvement, eosinophilia, asthma, P-ANCA. Okay, Church-Strass, the beginning we have discussed associated with the P-ANCA, sir. Okay, and microscopic polyangiitis. Microscopic polyangiitis is also called as microscopic pan. Non-granulomatous, necrotizing vasculitis. Even in this condition, lung and kidney involvement will be there. Okay, lung and kidney involvement and P-ANCA positivity. Okay, P-ANCA positivity is going to be seen, sir. Done. So with this, all vasculitis are completed. All the vasculitis are completed, sir. Okay. So now after this, guys, shall we take a break of 5 minutes? Okay, shall we take a break of 5 minutes and shall we continue with the other topics in the vascular pathology? Important topics, very important topics like atherosclerosis, the vessel tumors. Okay, very much important for the NEET PG exams. So now let's take a break of 5 minutes and we'll continue after 5 minutes, sir. Okay, not just 5 minutes, just 3 minutes are more than enough. Okay, we'll continue in the 3 minutes break. Okay, welcome back guys. Break is enough. Now let's complete the other important points which you need to know regarding the blood vessels. Okay, so other topics which you need to know for your exams are the blood vessel tumors. The tumors of the blood vessels are, okay, so vascular tumors. There are three types of vascular tumors. What are they? Benign tumors, intermediate risk, intermediate risk means risk for the cancer. Okay, there is a chance that these intermediate tumors can turn into cancers. There is a chance they can turn into cancers. And malignant, the high risk malignant. Not just high risk, they are malignant, so they are the cancers. So benign tumors are there, intermediate tumors and malignant tumors. Malignant tumors are the cancers. Now what are the benign tumors that you need to know? So the first one is capillary hemangiomas. First one. Second one is cavernous hemangioma. And third one, glomangioma. So there are three types of benign tumors. What are they? Capillary hemangiomas, cavernous hemangiomas and glomangiomas. There are three types. Okay. So all these are benign tumors. They are not the cancers. They are not the cancers. Image based questions are very important. I will show you. So the intermediate risk tumors are Kaposi sarcoma. Kaposi sarcoma. Okay, Kaposi sarcoma. And malignant tumors, malignant means cancer, it's absolutely cancer. The cancer of blood vessel is called as angiosarcoma. Okay, angiosarcoma. Okay, angiosarcoma. Okay, so these are the three types of tumors which we have to study now. Capillary hemangioma, cavernous hemangioma, glomangioma, Kaposi sarcoma and angiosarcoma. Now look at here. So the first type which we are going to discuss here is capillary hemangiomas. So capillary hemangiomas. Now, image based question they will give you a child. Now they go, he is having this. First of all, okay, I have seen many children, even in my family, they have this capillary hemangiomas. My question to you, so this is the blood vessel tumor. So this tumor is actually made up of what? This tumor is actually made up of the blood vessels. So all these are the blood vessels. My question to you, so this capillary hemangioma, okay, a type of capillary hemangioma called as strawberry hemangioma. Okay, so now tell me, sir, are they going to persist throughout the life? Are they going to regress? My question to you, what do you think? So are they going to persist throughout the life or are they going to regress? They will regress, sir. They will regress. Okay, so important points. What are the most common site? The most common site is the skin. Okay, most common site is the skin and mucous membranes. They are non-capsulated tumors. They are non-capsulated tumors. They will start regressing. They will start regressing by the age of 1 year and they will completely regress by 7 years. Okay, these are all the MCQs, sir. They are regressive in nature. They are not going to persist throughout the life. They will start regressing by 1 year and completely they will regress by 7 years. Okay, 7 years of age. And image based question also. See, when you take a biopsy from that tumor, that capillary hemangioma or the strawberry hemangioma, now you can very clearly see these are the blood vessels, sir. These white spaces, what exactly are they? These are the blood vessels. How can you ask me? You can ask me, how can you say that these are the blood vessels, sir? See, these are the blood vessels because inside them, are you able to appreciate they are the RBC, very clearly seen, right? They are the RBCs, sir. Okay, so these are the blood vessels with lot of RBCs, blood cells. Okay, so done. Now after this, they go, what is this, sir? The next type of benign tumor that we are going to discuss are cavernous hemangiomas. Okay, cavernous hemangiomas. Okay, now point number 1. So these cavernous hemangiomas, are they going to regress? Are they going to, yes, of course they are benign, no doubt. Are they going to regress? Do not regress. Do not regress. Okay, they do not regress, sir. They are not going to regress. Next thing is, sir, this cavernous hemangiomas, how to identify them? How to differentiate them from capillary hemangiomas based on the histology? Look here, so this is a blood vessel. Okay, this is a blood vessel, sir. So these blood vessels are highly branched. Okay, the blood vessels are highly branched, sir. Okay, these blood vessels, they are highly branched. Okay, here they are not like this. They are the proper blood vessels. Now nice and round blood vessels, sir. Okay. Beg your pardon. Said you right, I have allergy. Okay, usually I used to get these allergies. So here also you can very clearly see on biopsy, you can see highly branched blood vessels. Okay. So this is one thing, sir. Now let me write one by one important point. They do not regress and they are again non-capsulated tumor. They are non-capsulated tumors. There is no capsule around them. There is no such thing as a capsule. What are the most common sites? Bone and skin. See, even the capillary hemangiomas are also going to occur in the skin. But here something important, skin, liver involvement will be seen, sir. So even in liver, this cavernous hemangiomas can be seen, and even in the central nervous system. So organ involvement. Most common sites are skin, liver and central nervous system. MCQ, skin, liver and central nervous system. These are the MCQs. Now, one important point about the cavernous hemangiomas is, guys, can you tell me? So this cavernous hemangiomas, okay, of course, you know it, they do not regress. They are associated with, okay, they are associated with which condition? They are associated with von Hippel-Lindau syndrome. They are associated with the von Hippel-Lindau syndrome, again MCQ. CNS involvement, liver involvement, von Hippel-Lindau syndrome, they do not regress. How to identify them? See, there is branching, extensive branching of the blood vessels. Okay, you can say these are the blood vessels, because see, very clearly RBCs are seen. So the blood vessels are going to be extensively branched. Branching of the blood vessels are going to be seen. Okay, branched blood vessels. So they are associated with the von Hippel-Lindau syndrome. Now you can very clearly see here, von Hippel-Lindau is very, very important for your exam. See, in von Hippel-Lindau syndrome, the patients are going to have multiple tumors in the body. Okay, not one thing, multiple tumors in the body, sir. What is the mnemonic? CARPEP, C-A-R-P-E-P, CARPEP. What is this CARPEP, sir? So देखो cerebellar hemangioma, देखो hemangioma, central nervous system involved, hemangiomas, cavernous hemangiomas, okay, in the cerebellum, cerebellar hemangiomas, retinal angioblastoma, renal cell carcinoma, PEEP4, pheochromocytoma, all these are the tumors, ependymal tumors, endolymphatic sac tumors, pancreatic tumors. So in von Hippel-Lindau syndrome, one point I want you to know is that von Hippel-Lindau syndrome is associated with the hemangiomas. Okay, which hemangiomas? Cavernous hemangiomas. They do not regress. Most common sites are skin, liver and central nervous system. Do not regress. Highly branched blood vessels are seen on the biopsy. Okay, associated with VHL, von Hippel-Lindau syndrome. This is not important. Next, the third type of tumor is glomangioma. I have explained you. Glomangioma, sir. See, what is this glomangioma? See, under your nail bed, under your nail, actually there is something called as a glomus body. There is something called as a glomus body, sir. It's a arteriovenous, anastomosis. There is directly artery is going to meet with the vein. Okay, there is something called as arteriovenous anastomosis under our nail bed. Now here, this arteriovenous anastomosis, it's forming a structure called as glomus body. So glomus body is present under our nail bed. If you have a tumor, okay, if you have a tumor to this glomus body, then it is called as glomangioma. Okay, so glomus body is present under our nail bed. What is the function of this glomus body? Thermoregulation, MCQ. Glomus body, thermoregulation. Okay, thermoregulation. If you are having a tumor of that, okay, if you are having a tumor under your nail bed, very painful conditions, are very painful tumor. That is called as a glomangioma. Okay, actually here you can see the tumor. This is a tumor, sir. Actually there is a tumor. If you take out the nail, actually there is a tumor present here. That is glomangioma. Okay. Now important points what you need to know for your exam is, so what is the most common site? The most common site is nail bed. It's a painful condition, it's a very painful condition. Okay, it's a very painful condition. Sir, from where this tumor is originating? Origin, glomus body. Sir, what exactly is the function of glomus body? Thermoregulation. And what exactly is glomus body? It's arteriovenous anastomosis. Now, it's also a blood vessel tumor, right? It's also a blood vessel tumor. So look here. What you can see, sir? Okay, how you can appreciate? the histology, how you can identify. So these are all the blood vessels. Dekho, this is a blood vessel. Okay, this is a blood vessel. How can we say these are the blood vessels? You can very clearly see RBCs are inside them. So definitely this is a blood vessel tumor of the blood vessels. Now important point is, look, sir, in the wall, okay, in the septa, in these blood vessels, are you able to appreciate these blue color dots? These blue color dots, sir. Are you able to appreciate these dots? Everywhere they are present, dekho. But have you seen such kind of dots here? See, there is no such thing. Monomorphous dots are not there. Okay. See, somewhere like little dots are there, but extensively they are not present. Even here, they go. In the septa, extensively those blue color dots are not present. But in glomangioma condition, monomorphous, all dots are of similar size. Monomorphous, I will show you. See, dekho. There are monomorphous. Here, look here. In the septa, how beautiful they are. See, there are monomorphous cells are present. Okay. So this is something very much important. Monomorphous round to polygonal cells. Okay. Now let's write one by one. Branching of the blood vessels is seen, no doubt. So in histology, what you can see is, yes, branching of the blood vessels. Here also there and there also there. Both the places. Cavernous also branching of the blood vessels are seen, and glomangioma also branching of the blood vessels is seen. Branching of blood vessels is seen. Not only that, what you can see, okay, monomorphous round cells are seen in the septa. Monomorphic round cells are seen in the septa. Okay, so that's the one important point I want you to know. Glomangioma, image based question they will give you. They will show you the nail bed and they will show you a small tumor and they will say it's a very painful tumor. What is this? Glomangioma. Okay, glomangioma. Image based question also. Now you know how to identify it. So these are the blood vessels. See here you can clearly see the RBC. So definitely it is a blood vessel. So in the septa, okay, in this wall, you can very clearly see monomorphous cells. Okay, monomorphous cells. After this, okay, we have completed the benign tumors. So the 3 benign tumors are completed. Okay, I have shown you 3 benign tumors. What are they? Capillary hemangiomas, or the strawberry hemangioma, which will undergo regression by 7 years of age. Cavernous hemangioma, which will never undergo regression. Okay, associated with von Hippel-Lindau syndrome. And glomangioma, nail bed tumor. 3 conditions completed. Now we have to discuss about Kaposi's sarcoma, sir. So regarding Kaposi's sarcoma, what are the important points which you need to know? Now my question to you, Kaposi's sarcoma is seen in which people? Guys, can you tell me Kaposi's sarcoma is seen in which people? Kaposi's sarcoma is seen in which people? Do you have any idea, guys? One more, excellent. It is seen in HIV or immunocompromised people. Immunocompromised patients. Okay, Kaposi's sarcomas. So these are the intermediate risk tumors which are seen in patients who are suffering with HIV or immunocompromised people. Now my question to you is, sir, what is the causative agent? Sir, it's a cancer. It's almost intermediate, like tumor. Okay, but what is the causative agent? Right. It is associated with a virus, sir. Actually, it is associated with a virus. A virus is going to cause this problem. What is the causative agent? Do you think HIV virus is causing this vessel problem? The tumor of these blood vessels? Kaposi's sarcoma? No. The causative agent is HHV8. Human herpes virus 8. Okay, human herpes virus 8, sir. So those people who are suffering with immunocompromised state, they will get this virus, HHV8 virus, and this HHV8 virus is going to go and attack the blood vessels, and that will cause Kaposi's sarcoma. Now, questions which were asked in the exam. What is the most common site? The most common site is lower limbs. Lower limbs, you can very clearly see these are the image based questions. They will give you, sir, what exactly? This is a classical image. Every time they will give you in your exam. This is the same image that will come in your exam, sir. Kaposi's sarcoma. Lower limbs are affected. Immunocompromised states. HIV patients. The causative agent is human herpes virus 8. Okay, and if you look at the biopsy, what you can appreciate? So this is the biopsy. What you can appreciate here? First of all, these are the blood vessels. No doubt, these are the blood vessels. These are the blood cells. These are all red color things are the blood cells. But if you look at these blood vessels, so the cells are like spindle shape. So the cells, they are like spindle shaped cells. Okay, so the cancerous cells, they are like spindle shape. You can very clearly see the wavy spindle shape appearance, right? So on microscopy, what you will see? Microscopic examination on histology, there are spindle shaped neoplastic cells present. Okay, spindle shaped neoplastic cells are seen. Okay, along with the RBC and blood vessels, spindle shaped cancerous cells are going to be seen, sir. Okay, that's the important point about the Kaposi's sarcoma. Okay, it's not needed for you. Next, the last cancer which we are going to discuss is angiosarcoma. Angiosarcoma, what exactly it is? It's completely malignant, absolutely malignant, sir. It's a cancer. It's a cancer. Angio means blood vessel, sarcoma means cancer. So just for your understanding purpose, some students like some students like me, they will just little deviate. They will just deviate, sir. We have completed benign tumors. Also, we have completed Kaposi sarcoma. Now we are going to start the angiosarcoma, malignant cancer. Okay. Now my questions to you: who will get this angiosarcoma? Very aggressive tumor, sir. Very aggressive. Very bad prognosis is there. Now, can you guys tell me? Angiosarcoma, who will get this? HIV patients, immunocompromised patients. Which patients are at risk of developing angiosarcoma? Come on. One more, Reen, Varun Kashyap, Dan, Rishiraj. Any idea? Who will get this? Those people who are exposed to certain chemicals, arsenic, sir, arsenic. Okay, arsenic poisoning, polyvinyl chloride exposure. Okay, let me write first important points. So, angiosarcoma, it is a cancer, it's a neoplasm of which cells? Endothelial cells. It's a neoplasm of endothelial cells, so cancerous cells. Okay, it's a cancer of endothelial cells. Okay, what are the risk factors? Risk factors include arsenic. Okay, arsenic, polyvinyl chloride exposure, and thorotrashed. Okay, thorotrashed. What exactly is thorotrashed? It's a radio contrast agent used by the radiologist for getting better films. Okay, so it's a thorotrashed, it's a radio contrast agent which is injected. Okay, so into the body. So thorotrashed exposure, thorotrashed can lead to angiosarcoma, polyvinyl chlorides can lead to angiosarcoma, and arsenic poisoning can lead to angiosarcoma, sir. Okay, so how to identify this? How to identify this? MCQ. So these cells, these neoplastic cells, they are cancer of what? They are the cancer of endothelial cells, right? So these cells are positive. Okay, for which CD marker do you know? These cells are positive for CD31. CD31 positivity will be seen. Along with that, the cells are also positive for von Willebrand's factor. In immunohistochemistry, when you do the immunohistochemistry, even von Willebrand factor will be positive. Okay, the cells are positive for CD31 and von Willebrand factor. Why? Because they are present in endothelial cells. Von Willebrand factor is present in the Weibel Palladi bodies of endothelial cells. Helps in platelet adhesion, aggregation, clotting. And CD31, it's a marker of endothelial cells. Even in the cell injury topic we have discussed. Okay, it's not cell injury, sorry, inflammation. The topic of inflammation we have discussed. The marker of endothelial cells is CD31. The marker of selectins is CD62. Okay, we have discussed about that. So, on microscopy, what you will see is microscopic examination. This cancer, if you do microscopic examination, there is no proper pattern. Atypical cells are seen. Atypical neoplastic cells. Okay, atypical neoplastic cells which are positive for CD31 and von Willebrand factor. With this, angiosarcoma is also completed, sir. Okay, so I hope this will be enough for this class, guys. Tomorrow's class we will discuss about the arteriogram. sclerosis, arteriosclerosis, and other important cardiac pathologies. Tomorrow we are going to start with the cardiac pathologies also. We are going to start about rheumatic fever. We'll discuss about the infective endocarditis. Okay, other important cardiology related topics. Okay, dilated cardiomyopathy, hypertrophic cardiomyopathy, restrictive cardiomyopathies. Okay, the myocardial infarction. What are the gross morphological changes and microscopic changes that are seen in the MI? Okay, ST elevated MI, non-ST elevated MI. These things we'll discuss in the subsequent classes. Okay, I think this will be enough for today. Why? Because it's already getting late. It's getting 11 o'clock. Okay. Okay, enough for today. See you. Bye bye. See you tomorrow. See you. Bye bye. Fun mode. Bye Varun Kashyap. Bye Reen. See you tomorrow. Bye bye.